morning everybody, respected teachers and my fellow batchmates. Myself Tanvi, and we are here as a group of 10 to present a seminar on the topic Galactosemia. So let's see what is Galactosemia. Galactosemia, it is a rare autosomal recessive disorder occurring due to absence of an enzyme Gode, also called as galactose 1-phosphate uridyl transferase. It is responsible to convert galactose eventually into glucose. Okay, so let's get a little insight into this. Galactose metabolism, it is helpful, or it produces fuel for cellular metabolism by its conversion to galactose 1-phosphate. We'll see the cycle in fourth slides. And it is also responsible for formation of certain galactocytes such as glycolipids, glycoproteins, and glycosaminoglycans. Galactosemia is further divided into certain types. So let's see. It will be elaborated further. Now let's just name them. That is type 1 galactosemia, type 2 galactosemia, and type 3 galactosemia. Type 1 galactosemia, it is classical galactosemia. It occurs due to deficiency of an enzyme Gode, as mentioned before. And type 2 occurs due to deficiency of galactokinase. Now type 2 is a little milder than the type 1, it is severe. And then comes the type 3 galactosemia, it is called UDP gal epimerase deficiency. This epimerase enzyme epimerizes UDP galactose to UDP glucose, and if this is deficient, it could lead to hypoglycemia, which will again be elaborated further. And now hand over the mic to Gode.
Thank you. Now let's see us related. Now let's see a skit about galactosemia. Scene 1. Parents enter with their child suffering from galactosemia in the hospital.
नमस्कार. या बसा. धन्यवाद. काय झालंय बाळाला? बाळाला ते काय झालंय बाळाला? काय म्हणजे नेमकं झालंय काय? काय ते सांग की ग. बाळा दूध पिल्यावर उलट्या करत आहे आणि त्याची त्वचा थोडी पिवळी पडली आहे आणि खूप चिडचिडपणा करत आहे. तुम्ही याला तपासून घ्या. ठीक आहे, मी बाळाला तपासते. अरे बाळा, काय झालं तुला? त्याचं नाव काय आहे? त्याचं नाव किवी. त्याचं वय किती आहे? वय ठीक आहे, मी तपासते बाळाला. बाळाची त्वचा पिवळी झाली आहे, त्याला कावीळ असू शकतो. मी तुम्हाला काही टेस्ट लिहून देते, ते तुम्ही करून आणा. हे घ्या आणि करून आणा. बाय ते. अगं कुठे आलीस? ये लवकर.
स्वराज कुठे? ए स्वराज इकडे. व्हेरी स्वराज फ्रॉम. हे बघ, आपल्याला 3 टेस्ट करायचे. ब्लड टेस्ट, युरिन टेस्ट आणि लिव्हर फंक्शन टेस्ट. लवकर ते किट घे आणि सॅम्पल काढ. अरे हाताला नाही, पायाला असतं ते. लिव्हर टेस्ट. दिसलं का?
हो.
दिसलं. हो. हे बघा सर, हे तुमच्या बाळाची रिपोर्ट.
वाच गं जरा इंग्रजीत आहे काहीतरी.
हे तुम्ही डॉक्टरांना दाखवा. डॉक्टर तुम्हाला सांगतील.
अच्छा ठीक आहे चालेल.
हो मावशी, बाळ घेऊन जा.
काय एक तास दिलं तरी नाही करू शकत. नमस्कार. रिपोर्ट आले आहे. बस.
ठीक आहे, मी तुमचे रिपोर्ट्स बघलेले आहेत. तुमच्या मुलाला गॅलेक्टोसेमिया झाला आहे.
गॅलेक्टोसेमिया? आता ते काय असतं?
मिया आणि गॅलेक्टोसेमिया.
आता ते काय ते तरी सांगा.
चला आता आपण सगळे जाणून घेऊ गॅलेक्टोसेमिया म्हणजे असतो काय.
Galactosemia is a rare autosomal recessive disorder. It's an inborn error of metabolism. Its incidences are 1 in 35,000 births. Okay, let us understand the metabolism of the galactose through the reaction. Okay, milk and dairy products contain the lactose, which are the major dietary sources of the galactose. Okay, galactose first phosphorylated by the galactokinase to form galactose 1-phosphate. In presence of magnesium and ATP is consumed, and the galactose 1-phosphate with the enzyme galactose 1-phosphate uridyl transferase is a rate limiting enzyme gets converted into UDP galactose. Then UDP galactose is further epimerized by the uridine diphosphate galactose epimerase to form UDP glucose. Okay. And there is an alternate pathway to form the UDP glucose from galactose 1-phosphate, that is through galactose 1-phosphate pyrophosphorylase. Galactose 1-phosphate pyrophosphorylase is enzyme present exclusively in the liver, and it gets activated only after the 4 to 5 years of the age. So this is an alternate pathway to form UDP galactose through galactose 1-phosphate, and then UDP galactose finally epimerizes to UDP glucose. This reaction shows the summary of galactose metabolism. Okay. When there is a deficiency of this enzyme, uridine diphosphate, galactose 1-phosphate uridyl transferase or galactokinase, the accumulated galactose, this accumulated galactose is diverted to form reduced form, that is galactitol, through aldol reductase, and this aldol reductase is present in seminal vesicles, lens and the nervous tissue to form galactitol, and this galactitol has many harmful effects as it gets accumulated in the nervous system and cause mental retardation, and in lens form cataract. clinical features of the galactosemia. These are the mental retardation, congenital cataract, is the classical feature of the galactosemia, jaundice, hepatomegaly, kidney damage, hypoglycemia, and galactose and amino acids in the urine. And other clinical features also include vomiting, lethargy, irritability, ascites, and poor weight gain and feeding difficulty. This is how the cataract looks. This image shows the difference between the normal and the eye with the cataract. Here the normal lens and here is the clouded lens. Okay. What is cataract? Cataract is the opacification of the lens of the eyes. It can be by the two ways. Galactidol accumulation, and galactidol is an alcohol. It has an osmotic effect as it attracts the water and causes the osmotic change. And this osmotic change will lead to the loss of transparency of the lens and leads to the cataract. Or excess galactose and galactose 1-phosphate. This will inhibit the glucose 6-phosphate dehydrogenase. This glucose 6-phosphate dehydrogenase is used in HMP pathway to decrease HMP and decrease NADPH, and depletion in the glutathione will be responsible for insoluble lens protein and finally leads to the cataract. Now the further explanation will be given by Tejaswini.
Let's see the further report of QV cells. Firstly, galactose 1-phosphate uridyl transferase activity. Its normal range from 18.5 to 28.5, but in our case less than 1%. It significantly decreases due to deficiency of the CALT enzyme. Secondly, total galactose level. Due to deficiency of the CALT enzyme, galactose and galactose 1-phosphate will be accumulated. Its normal range is less than 10 mg per deciliter, but it elevate up to the 22.7 mg per deciliter due to deficiency of the CALT enzyme. Urine reducing substance test, normally it is negative, but in our case it is positive due to the elimination of excretion of the galactose in urine. It gives reducing substance test positive. Blood glucose level, normal range of blood glucose is 70 to 110 mg per deciliter, but in our case it is 62 due to the decrease of due to galactose 1-phosphate accumulation. It inhibits the galactokinase as well as the glycogen phosphorylase enzyme. Inhibition of the glycogen phosphorylase enzyme also inhibits the glycogenolysis. That's why the blood glucose level is decreases. Liver enzyme HGPT and HGOT, its normal range less than 40 international unit per liter, but in our case it mildly elevated due to the liver damage due to accumulation of the galactose or galactose 1-phosphate. Basically, there are 3 types of galactosemia. Type 1, which is also called as classical galactosemia, type 2 and type 3. Type 1 galactosemia is caused due to the CALT deficiency. Its incident 1 in 35,000 birth. Its symptoms recurrent hypoglycemia, hepatomegaly, jaundice, congenital cataract, amino aciduria, galactosuria. Let's see the basis of its symptoms. Firstly, hypoglycemia. Hypoglycemia caused due to decrease in CALT enzyme activity. Galactose 1-phosphate does not convert it to UDP galactose. Due to accumulation of the galactose 1-phosphate, it inhibits the galactokinase enzyme as well as it inhibits the glycogen phosphorylase enzyme. Glycogen phosphorylase enzyme is key enzyme in glycogenolysis, which glycogen converted into glucose. Due to deficiency of the glycogen phosphorylase, glycogen does not convert it into glucose, and that's why the hypoglycemia can occur. Amino aciduria, due to glycogen 1-phosphate accumulation in the renal tubules. Due to glycogen 1-phosphate accumulated in the renal tubules, causing tubular damage and leading to the amino aciduria. Congenital cataract.
is mild type. Basically, galactokinase convert the galactose into galactose 1-phosphate due to deficiency of the galactokinase. Galactose does not convert it to galactokinase, and galactose accumulated in the liver. It further reacts with aldol reductase and it converted to galcidol. Galcidol accumulated in the lens which causes cataract, and accumulation of the galactose in liver causes hepatomegaly, which is mild type. Type 3, due to deficiency of the UDP gal deficiency. Uridine diphosphate galactose 4 epimerase enzyme convert the UDP galactose to the UDP glucose. Due to deficiency of the UDP galactose epimerase, UDP galactose does not convert it to the UDP glucose, and that's why UDP galactose accumulated, and accumulation of UDP galactose also causes the hepatomegaly. It is also the mild type. It is caused due to defective gene, GALE gene, GALE gene, due to mutation or defect in this gene called type 3. Type 1 caused due to the defect in the gene GALE, and type 2 caused due to defect in gene GALK1, GALK1 gene. Further explanation to that.
तर बॉडीमध्ये नेमकं होतं. सो लेट्स सी अ स्किट अबाउट गॅलेक्टोसेमिया. सो गाइस, वेलकम टू द बॉडी.
Special delivery. Just got some milk down here, and it's full of lactose.
Hey everyone, I just came here from milk, ready to party.
Uh-oh, galactose is here. Has anyone seen GALE?
I am trying, but I cannot function properly. I have a condition.
What? You're supposed to break galactose down. If you don't, it builds up.
We can't handle all this extra galactose. It's leaking into urine. Galactose 1-phosphate is accumulating in my renal tubules, causing damage and leading to amino acid urea.
Hey, it's not my fault. I just came here from milk. Don't blame me. I thought I was welcome here.
Normally yes, but in galactosemia we can't process you. You turn toxic.
Guys, can anybody see? I can't see. What these milky things on me? Get it off me.
So guys, now let us see a scene where galactose is not metabolized.
Guys, it's getting foggy, okay? Now, do you want me to start having convulsions?
I told you, I am deficient. I was born this way. It's genetic.
अरे शॉर्ट हो गया लाला. There is inflammations everywhere. The baby is going to be really sick.
But due to blockade enzyme GALE, galactose 1-phosphate accumulates in me and I'm gonna get enlarged.
And I still can't see.
What? You can't see me? But let it be. It is getting harder and harder to fight the infections. Somebody, for God's sake, do something.
Now all the organs assemble for emergency relief. Table C.
Organs, assemble.
Alright team, we need a solution. No galactose, no dairy, no lactose. Got it?
No milk, but cheese, ice cream.
Out all of it. We are strictly dairy free now.
Hey, is this about me again? I bring flavor, guys. I bring vibes. I bring drama.
Hey, I will personally electrocute you right now if you don't leave, okay?
Hey, you will miss me, guys, when I'm gone.
When someone has galactosemia, the body can't process the galactose properly. This causes serious problems, especially inside babies. But there's a way. Now let us see a scenario where galactose is completely restricted.
Thank goodness, now no more overload.
Guys, clear thoughts again.
Look, I can see.
Immune system.
Security report. There is nothing to fight today. Everything is fine now.
I am still not working, but because of the diet, I am all better now.
And so the body has found balance again. With early diagnosis and careful diet, galactosemia can be managed, as well as the mental retardation can be prevented. So doctor, what is the treatment for this?
So, the treatment for galactosemia include complete elimination of galactose from diet since from birth to prevent mental retardation, liver damage, congenital cataract and recurrent hypoglycemia. Now coming towards the management of disease, as I have told earlier, the management of disease is only eliminating lactose and galactose completely from the diet. Infants with classic galactosemia cannot be breastfed because of the presence of lactose in human milk. Therefore, they are usually fed a soy-based formula. Things like buttermilk, curd, chocolates, etc. should be completely eliminated. Now, I further hand over mic to Tejfia.
Now let's see the diagnosis evaluation. So the infants affected by glycosemia typically present the symptoms of lethargy, vomiting, diarrhea, failure to thrive and jaundice. There are certain tests done for this, which are newborn screening and galactosemia test. In newborn screening, amniocentesis is performed, which will help the mother. She will not breastfeed her child. Then in galactosemia test, blood or urine sample is taken and checked for the required enzymes. Screening tests are used to screen infants affected with galactosemia, the Buehler's test, the mucic acid test, which is specific for galactose, and the Hill's test. The Buehler's test. The procedure is follows. The drop of blood is incubated with galactose 1-phosphate and UDP glucose. If galactose 1-phosphate urinary transferase is active, it catalyzes the formation of UDP galactose and glucose 1-phosphate. And the reaction is coupled with NADP reduction to NADPH, which fluoresces under the UV light. So basically, if the test is positive, the blood spot will fail to show any fluorescence under the UV light, and therefore it will detect that there is deficiency of GALT enzyme. So here we end our seminar discussion. Thank you everyone for your patience.